of state fiscal year 25. So we have made it to the last meeting of this year. Again, thank you so much for being here and for participating throughout the year. Next slide, please. Again, really excited about this opportunity for us to be together. Again, we've taken a little bit of time to get settled in. And again, as needs come up, please feel free to meet those needs. We'll have a break during our time together, but if there's something you need to step away for, or if there's something that you need to do, please feel free to do that as we make our way through our time together. So I think I see a couple of guests, so we want to take an opportunity to welcome our public attendees to our meeting. I just wanted to go over a couple of meeting participation guidelines as we get started. So if we happen to have polls or a voting during our time together, that is only open to our HVAC members. And then we'll have a portion of the meeting where you can ask some questions or offer some input. So kindly wait for that time in our agenda to be able to do that. And we'll be sure to highlight those when that's available and appropriate. And then if there's any kind of technical issues or challenges that you have, please reach out to Erin Kerrigan, and that you can find her in the chat and just send her a private message and she'll be able to kind of support whatever needs you have. Next slide, please. All right, and I think we have done this already. So if you haven't, the first part we haven't done. So in the chat, just put your name, organization, and role. And if you have not made a change to how your name shows up in your Zoom square, here are some instructions on how to do that. So we'll just pause here for a couple of minutes just to allow for the chat to get populated and for you to make any changes to your name that you need to. I see the chat populating. We will continue to move through, and as you're able to, just continue to put your information into the chat. Next slide, please. All right, so hopefully you received an agenda, and for any of our guests, I know you didn't receive an agenda, but here's our agenda for how we're going to spend our time this morning. So we'll do our first part, which we're in, which is some community engagement and just have meeting housekeeping pieces. We'll get into a legislative update here and then a budget update. And then we'll have some kind of general updates around the subcommittee, and we'll talk about our FY26 calendar kind of dates and talk about our meeting in July. It just seems so strange that we're already in June. It doesn't feel like it's been that long, yet here we are halfway through the year. Next slide, please. So here's our kind of community builder, icebreaker, ice melter. I think it's called a variety of different things, but just an opportunity for us to pause and get to know each other a little bit. So I'm going to put you into a couple of, well, probably several small groups. And then these are the two questions, one of the two that I'm going to ask you to share with each other. If you could be a character in any movie, what character and what movie would it be? Or if you invented an ice cream flavor, what ingredients would it have and what would it be? So one of those two questions, and give you some time to do that. I'm going to put them into the chat as well. If anybody's like me, the minute I get into the room, I forget what we're supposed to be doing and how to access the questions. So There we go. It's in the chat. I will open the groups here in just a second. We'll give you 5 to 6 minutes. The rooms will open here in just a minute. There you go. Give you 5 to 6 minutes. You should see an option to join on your screen. If you don't, let us know and we'll help support getting you into the right room. All right, so welcome back. It looked like some of you might have been cut off mid-sentence, but hopefully that was enough time for you to share. So I'm wondering if there might be a couple of brave people who answered question number 1 who'd be willing to share in this space. So if you could be a character in any movie, what character and what movie would it be? Anybody willing to share?
Okay. I decided that I would like to be from the movie The Princess Bride. I think I would like to be Miracle Max's wife, and just just a little forest witch doing my thing, nothing too dramatic. Occasionally bringing people back from being nearly dead, but probably pretty quiet most of the time.
Thanks for sharing.
I
love that
picked
movie.
Princess Bride as well. And I picked it to be Princess Buttercup, not because I want to be a princess, but I know most of the lines from the movie, and I would not have to learn a whole bunch of new lines to be in the movie. So, and everybody in that movie was hilarious, and I can just imagine sitting and chatting with the other participants in it being hilarious. So look at us, match.
Thank you, Cassie. Thank you, Allison. Love that movie. That movie. We have a couple people wanting to share, willing to share. If you invented the ice cream question.
Well, I'll just share that we didn't really invent ice cream, but we pined after ice creams have passed. And also had a consistent coffee theme running across all of our, but whether that was really for ice cream or just coffee itself, it remains to be a little bit blurred.
Opportunity for one more person if somebody's interested in sharing.
My invention was coffee and chocolate, which is really quite boring and not an invention at all. I think it exists out there. And then with the discussion of everybody else's ice cream, we decided, or I added some of the other elements from others, including salt, little sprinkle of salt flakes on top.
That sounds delicious, Monica.
We had a good a collection of folks that really liked licorice ice cream, which is not commonly liked by a lot of people, but 3 of the 4 of us love licorice ice cream, so that was a theme.
That would be interesting. I'd be willing to try. I'd be willing to try. Again, thank you so much for being a part of that. If there are other things that you remember or things you want to share about our community builders this morning, please feel free to do that in the chat. So we will transition to our first topic for our agenda today, and it's our legislative update. And we have Julie Watts and Erica Halleck, who will walk us through a legislative update. And I'll give Julie an opportunity to introduce herself. She is new to our space, just so you know who Julie is and what part of DCYF she's in. So Julie, if you don't mind introducing yourself, and the way that I have the slides in order, I know we didn't touch base, so I hope this is okay and we can move them if we need to. I had Erica starting first and then moving into you, Julie. Okay. Okay. Go ahead, Julie. Thank you and welcome.
Great, thank you so much. My name's Julie Watts, obviously. I'm the new Deputy Director for Government Affairs for DCYF. So I've been with DCYF for the last 5 years, working mainly in the child welfare space. And so as our team is going through some transitions, I'm kind of popping in for the role that Mary Sprudy used to do. We miss her terribly, but glad she's over at the governor's office. But I'm kind of covering until we kind of have some new structure for the government affairs team, kind of going to be covering the home visiting space. So it is good to meet you all, and thank you for having me.
Next slide, please.
Great. Well, thank you, Julie. And looking forward to continuing to work with Julie. I've had the pleasure of working with Julie in different spaces, and I can affirm that we are continue to be in really good hands with their top-notch government affairs team. So look forward to talking a little bit about this challenging legislative session that completed. I think it's been 6 weeks now or so. So I'm going to give just a general overview and then kick it back over to Julie. And I know we've talked about this in previous meetings, and this is not necessarily new news, but I think it's important just to recap kind of where things were at before Julie talks about home visiting specifically, because it is important to look at the home visiting funding within the larger context. So Washington State is one of the only states that requires a 4-year balanced budget, which honestly makes the budgeting more challenging, particularly in tough budgeting times. That means they not only have to balance their budget for 1 year, they have to ensure that it is balanced for 4 years. So that makes their ability to have different budget shenanigans, if you will, it makes it more challenging for them. So as we went into this legislative session, lawmakers were facing an estimated $16 billion budget cap over that 4-year period. So that was a very substantial gap. At the same time, of course, as we all know, we had a new governor. We had a new legislative leadership in the Senate, in particular, a new majority leader, and just a whole slew of new lawmakers that were coming in that didn't know, a lot of the issues. There was a lot of people to bring up to speed. A lot of people too that had never gone through a downturn, really, that had only been here when we were growing and we had new money to invest. So a lot of change. Ultimately, as we know, they did conclude and they closed that gap, and they were able to do so with a mix of cuts and delays. And they ended up passing $9 billion in new revenue, which is the largest new revenue that our state has ever enacted. So we'll see. That is the estimate. We'll see how much actually comes in at the end of the day, but that is the estimate, including a number of new taxes on various businesses, including lobbyists. So, the spreading the pain, if you will. So next slide, please. So as you probably have heard, early childhood was a frequent topic of conversation back in 2021. The Fair Start for Kids Act was passed, and it had a lot of expansions planned for Working Connections childcare and ECAP. And one could argue that it was incredibly popular, so popular that when you saw all the charts about expected funding, it went like this. And the costs to incorporate all of those planned expansions just became, frankly, unaffordable for the state, given the state's budget situation. So at the end of the day, about $1 billion out of that 16 billion came from reductions, delays to the Fair Start for Kids Act. So families, we were supposed to see entitlement for ECAP achieved in the next biennium. That has been delayed to the 30-31 school year. We were supposed to see Working Connections childcare expand to families earning up to 75% of the state median income. That too was delayed. Additionally, transitional kindergarten, which was passed in the 2023 school year, that similarly was incredibly popular. That also was paused. So we had just early learning was a frequent topic of conversation. Next slide, please. Not all the news was bad. And I think it's important to focus on positive things as well. We were able to secure collectively nearly $100 million in new capital funding for early learning facilities, which was great. And in the family childcare space, they are represented by SEIU, and there was a collective bargaining agreement that will bring just under $400 million to help support additional rates, health insurance, and other services for family childcare providers. And while there were reductions in the ECAP space, there also were investments for rate increases, as well as some additional slots in the full day space. So I think it's important to look at the larger context, and also to know that there was a lot of focus and discussion among budget writers and legislators in the early learning space. And now I'm going to kick it over to Julie to talk more specifically about home visiting. So thank you.
Okay, next slide, please. Well, this might be a little bit duplicative of what you heard from Erica, but just wanted to kind of, I think, Erica, you used the term that it was a challenging session. I feel like that's an understatement. It was, I used the term brutal several times throughout the legislative session when it came to like the conversations around the budget. Just overall, statewide program spending is outpacing our growth in revenue. And that is not something that, I think we expect that trend to turn on a dime. I think we're going to continue to see challenging legislative sessions over the next few years, unless something changes pretty dramatically. I will note that, one of the approaches that lawmakers took, particularly when looking at DCYF's budget, was to look for places where there was underspend. So places where we had had appropriate or allocated funds, and we weren't fully spending in that area. There were some of these areas in which they were seeing on the books, they were seeing underspend were not true underspend. They were just places in which we hadn't fully spent down, but had planned to by the end of the year, the dollars in those accounts. But in tough budget times, people are, they're looking for every dollar that they can find. And so there were a lot, certain areas where the department had to push back pretty hard on, the areas of the budget where they were trying to capture savings that weren't real savings. So I just want to acknowledge that didn't just happen. In certain areas, it was kind of across the entire agency budget that we, particularly in child welfare, that we saw this looking for underspend. We saw cuts across the board to multiple areas, and one of those was in home visiting. So do you want to move to the next slide? We have underspend that was in the 2025 current year budget. So we're still in fiscal year 2025, but that will close out at the end of this month. And so the legislature does a supplemental budget. And we did have underspend in the 2020 fiscal year 2025 budget. This was due to some contracts not completely spending down for various reasons. This always happens, staffing shortages or things like that. So some contracts don't completely spend down in the fiscal year. DCYF also made a decision not to do service expansion until we had gone through a rate setting process and set rates. And there were some delays in the timeline for rate setting that resulted in some underspend in the home visiting services account. This is one time. We cannot, this underspend was one time. But the legislature looked at it and assumed that we could absorb underspend without service cuts over a longer period of time. And that's unfortunate because the department actually can't do that. So we were very clear in communicating to them that that underspend was one time, and yet they assumed that we could absorb that ongoing. So I just want to acknowledge that. So if the next slide. So I want to just kind of go over what the final budgets did. So, we're really looking at budget for 3 fiscal years that they were contemplating. One is the current fiscal year that we're in. Like I said, they took that 1.25 million in underspend. This will not impact services for this year because it was true underspend. For state fiscal year 2026, which is the next fiscal year starting July 1, in the general fund state dollars that are in the home visiting services account, they took a reduction of $1.5 million, assuming ongoing underspend from state fiscal year 2025. There was also a 10% reduction on the dedicated cannabis fund, which contributes to the home visiting service account. There was no change in the total available TANF funding. And in MCV, there was approximately a 6% increase in MCV funding due to increase in federal dollars on the table. So that's what they did in state fiscal year 2026. In state fiscal year 2027, they kind of moved the same assumptions forward that they assumed in fiscal year 2026. So together that resulted in kind of their taking about a $3 million reduction in the home visiting services account. So I'll just pause there and see if there are questions on that.
If there are any questions from HVAC members, we'll start with those, and then we'll have an opportunity for our guests to ask questions as well.
I just would like to say thank you. I appreciate your comment. I believe it was Erica who shared that the underspent might not truly be an underspent, that you had planned to spend more money as time got closer to the end. And it is kind of frustrating when it's just looked at as underspending in the big picture of the work that people are trying to do. So, yeah.
Sorry, I had to step away for just a second. Yes, it's very unfortunate. And at the same time, I think it's not surprising that the legislature was looking for pretty much any place that they could achieve savings. A $16 billion budget deficit over 4 years is significant, and it's unfortunate that they did that, and that they assumed that ongoing into the future, but it is not too surprising. DCYF took cuts to other areas as well, that were assumed underspends. So it didn't just happen in this one place. It was it was definitely an approach that the legislature took. Any other questions about? Okay. Matthew.
Is this the time when guests can ask? I didn't want to jump in incorrectly.
Yes, please go ahead, Matthew.
All right, thank you. Thank you for this information and the details that you're providing. I just wanted to make sure I had understood correctly. On the previous slide, you detailed a 10% reduction in dedicated cannabis funds. And I think I heard you say it's going to be about 3 million total, but is there a dollar amount connected to that 10%?
I'd have to get back to you on that after talking with our budget team.
Okay, thank you. And then similarly, I didn't know if there's a dollar amount tied to a 6% increase for the McVie funding.
I don't know, Laura or others might be able to speak to that who are on the call.
Yeah, I can provide both, Julie. The 10% reduction is a flat 10%. So our annual dedicated cannabis account funding had been $2.434 million since the second year that was passed. So it was a flat 10%. It's like a $230,000 reduction. The new amount is 2.19. I'll drop it in the chat here in a minute when I pull it from email. And there was other places where dedicated cannabis funding was also reduced. So it wasn't just the HVSA, it was across different program areas. I confirmed that with HCA actually this week about some of those impacts. And the McVie dollar amounts, I can drop in just a second to our federal fiscal year awards. You'll see that we had a 23 higher amount, 24 lower amount, and maybe I have that wrong, 22, 23, 24. 22 is higher. I'll drop it in just a second. I have the numbers for each federal fiscal year, Matthew, and it's a 6% increase from, I think, 23 to 24, which is the year that we're spending on right now. It doesn't align exactly with the state fiscal year, but the award amounts increased about that amount from 23 to 24. So I'll drop both numbers in the chat here in just a second.
Thank you for that. Thank you. And then Julie, at one point you said about 3 million total. Did I hear that right? Was that just kind of like on a state fiscal year about what the total cut is, or what did I miss here?
So of the general fund dollars that go into the home visiting service account, like that of those general fund dollars. So there was in each fiscal year a $1.5 million reduction. And so that results in a $3 million reduction over the biennium. So that's over the 3 million figure is over 2 years.
Okay, thank you. And that 1.25 from fiscal year 25, does that an ongoing cut in addition on top of the 3 million or no?
No, that's just for fiscal year 2025.
Okay, thank you. I thought I'd been trying to crunch and follow. I didn't know if it was gonna be a 4.25 total going forward.
Yeah.
3 million.
Yeah, 3 million.
Okay, thank you.
For the biennium, yeah.
The biennium. Thank you very much.
Any other questions? Okay. Well, I want to thank you for having me and appreciate the fact that this is, it's hard news, not great news to be seeing budget reductions in anywhere. But I believe that Laura or maybe others from the team are going to talk a little bit about how we're responding to this and trying to preserve services and trying to do some rebalancing in this in what we're paying for and what we're funding here. So I thank you for having me and giving me this opportunity to come.
Thank you, Julie, for joining us. We appreciate having you as well. Erica, thank you as well for providing legislative update. We are going to transition. So next slide, please. To our program update and some updates around contracts, and then how the budget that just presented is being implemented for state fiscal year 26. I think, Laura, you are kicking us off. Next slide, please.
I think I sure am. Thank you. There we go. Thanks. I also want to note that the department has updated the slides that were on presented. I think it was May 13th, 14th, something like that. Our external legislative webinar. Because there were some vetoes that the governor issued mid-May that impacted what was presented. So just as a heads up for everyone, I know that some people participated in that, and there has been an updated slide deck that was posted. And maybe someone on the community engagement team can drop in the link to where those updated slides are if people are interested in that. And I share that because we have it took some time. DCYF internally wanted to really explore and examine what all of the rules were across the department before we were communicating those out with programs. So it took us some time. And actually it was last Thursday, late in the day, and then Friday, following that communication, budgets started to go out with programs. So DCYF had a communication plan, and we did send that out to all of our programs and partners on Thursday afternoon, and then immediately after that began to issue our typical contract cycle documents with contractors on Friday last week. So local programs, some of whom are on the call, should have started getting their materials to prepare for state fiscal year 26 contracts last Friday. So just a bit of our timeline, and I believe, Nellie, correct me if I'm wrong, we did share that communication with HVAC as well, and if not, we can drop it in the chat also. You can go to the next slide. Nellie, am I right about that?
No, we did not share it with HVAC, but I will drop it into the chat right now.
Okay, thanks. And we're going through it right now. Julie went through this slide just a minute ago as well. And kind of scale you heard, I dropped in the actual numbers in the chat as well, so you can see what those are. We are currently in spending federal fiscal year 23-24. We actually don't have our federal fiscal year 25 award yet. That has not come. And that will be probably issued September 30th or so, which is usually what happens. The last day of the federal fiscal year, we get it. Anyway, so if you go to the next slide, Nellie, please, or whoever is doing slides. Our goal, as we were considering and figuring out how we were going to manage this overall approximately 10% reduction to the state budget, we looked at the key principles, starting, of course, first with families, and the goal to maintain as many services as possible to families. And also thinking about that in order to do that, we have to have our local programs, or LAAs, operational and stable as possible. And we also know that we have, as a department, not kept for some programs that moved into rates over the last year. They have seen some increases in their overall budget and revenue. Some have not. And then other LIAs have not seen the same increases because we have not moved forward with rates or not had the funding to do so. So we know that there's some instability in program as a result of overall funding not keeping pace with the costs. Another thing that we were seeking to do was implement standardized caseloads, which was a part of the rate setting process initially, and wanted to move forward with the caseloads that were identified in those rates. And then adjusting LAA contracts based on the availability of funds and informed by performance, not fully driven by that, but certainly informed by performance in the department. I think as you heard in the last meeting, did a kind of 2-year review of LAA performance and has been working with programs during that whole time, but certainly with some renewed focus on performance right now as well. You can go to the next slide. So we also, as a part of the reduction, knew that we would have to take reductions in order to preserve as many program budgets as possible, that the reductions would be at the DCYF administrative budget and some of our infrastructure supports. So, and with the goal of maintaining as many of those key supports as possible, trainings, while reducing the number of trainings, still making training available to programs, as well as model-specific technical assistance, continuous quality improvement, and some of the data infrastructure that's necessary to maintain the HVSA and meet all of the different funding reporting requirements and evaluation expectations. So the biggest impact on our LAAs is that we did remove performance payments. The home visiting services account is one of the few program areas in DCYF that had monetary incentives for meeting different performance metrics as part of our meeting the DCYF performance-based contracting requirements. When DCYF was created, there was a requirement that we move forward with an agency-wide performance-based contracting approach. We have had that in home visiting services account. We were at the beginning of that initiative rollout in DCYF and had some funding available to support quality and meeting of some of those metrics. And in order, again, to preserve operational budgets, we pulled the performance payment for LA contracts. And then we've reduced some of the administrative and infrastructure costs in order to not have to reduce service to the extent possible. I think there's one more slide that might be mine, Nellie. Sure. Is this one mine or is this one Renee's? Can you help me? I'm not tracking numbers very well.
That's Renee's.
Okay. One last thing that I'll mention before I pass it off to Renee is we did have 3 LAAs not continue services into 2026, or they are tapering down right now. These were shared with us just over the last couple of months. And this is something that DCYF doesn't take lightly because we know it takes a lot to start up and implement a home visiting program in community. And that these 3 organizations, or there's 2 organizations, but 2 different programs within one organization made a decision not to continue services. And we know that in order to maintain programs in communities, we have to be able to support budgets going forward into the future, because part of these decisions for organizations not continuing is financial, not fully, but partly. So with that, only one of those programs had any substantial state dollars to support some of the reduction in budget. The rest were mostly MCV and TANF dollars as well. So just noting that it wasn't, those 3 programs didn't fully support. Yeah, it is a big loss for those communities as well, and the families that were engaging in those services. So anyways, I wanted to share that, but also that of the 3, really one was only one had substantial state funding, and the rest were other funding sources. And And those programs were doing great work in community as well. So I will pass it off to Renee and watch for questions in the chat about anything I shared. And also, Erica, thank you for sharing, and Julie as well a little bit ago. We do have top-notch folks working on home visiting as well as early learning and child welfare in our state. Renee, I'm going to pass it off to you.
Basically, we were teed up to send out our pre-contract questionnaires to the overwhelming majority of our programs once we were allowed to communicate budget. And my team has kind of been working with programs during April and May to come around to what that might look like in the next slide. I'll talk about that in a minute. But so MCV programs, all of our MCV funded programs saw an increase to their budget. We used rates to inform what those budget increases. Everyone got an increase. Those folks who, when we looked at how much they currently receive for how many families they serve, we kind of did an internal comparison to how that compares to what the regional rate would be for that community. We made differential budget increases for those folks. So if somebody was very far away from their regional rate, they would see a higher increase than a program that was at closer to the rate. We are still unable to be anywhere near the rate for any of our programs, but what we were trying to do is at least bring people up so that the difference wasn't quite so. We didn't see a huge span across programs. There still is a span, but it's much narrower now with MCV. That, unfortunately, we're not able to do with state dollars. I think that was part of what we were going to use our underspend for, but don't have it anymore. The other thing is after because we're not going forward with rates, and after talking with model and programs decided that for the NFP caseload, we would hold at the 25 model fidelity caseload for this coming year, and that was really based on feedback from programs. So we can go to the next slide. And then as you all know, I think we talked about this at the last meeting, that we did a performance review in anticipation of significant budget impacts. We wanted to have we wanted to focus our work on how are families being served in communities and use that as a primary driver for any changes in budget. At the same time, we saw this loss of 3 programs that we learned about in late April, early May, which impacted our kind of context a little bit. Through the performance reviews, and our aim here is always around success and improvement, not around elimination or cut. We identified 9 programs who've really had some long-standing performance challenges and started immediately collaborating with them on developing performance plans that would result in improvements in primarily in enrollment, but there are some other areas. So there's some really articulated goals on how to accomplish that. Many of these programs are well underway in progressing on those performance plans already just within a month and a half of having them, but we anticipate that all of our programs in that category would be performing well by the end of the calendar year. We also identified another 9 programs in that performance review that had shorter term, or they were actually coming out of longer term performance challenges but their performance was still it wasn't quite bumping them up over the thresholds. Those almost all will be resolved by the end of this current year. And so that's kind of what was when we were looking at that, trying to figure out, based on this word, what we really ended up doing was using those performances to help drive really a kind of very healthy conversations with some of our programs around their budget sizes and their capacity and whether their slots were right for their services. And so I think what's been happening in the last month has been some looking at program size and capacity and service levels, and a lot of right sizing of slots according to what they are able to provide. And that could relate to longstanding vacancies in staffing or really challenging enrollment circumstances that they've just not been able to overcome. As a result of that, and then we have also really acknowledged that some of these performance challenges are related to longstanding insufficient funding. we have a program that's not able to dedicate dollars to management because they've simply not had enough dollars. And they, programs management is really, when I say that, I mean supervision. I mean program supervision. Management, not at super high levels. I'm just talking about program coordinators not having enough money to sufficiently fund a supervisor means that that program is going to have challenges in meeting its deliverables. And so that's partly what we've been looking at. I think McVie increases are going to help with some of those areas because our McVie programs were the ones sitting in the older budgets that hadn't been filled. And so there's that, but then also just looking really right sizing programs so that they could be more healthy in terms of the way they're allocating their resources. We've also made a priority of focusing our contracts with our tribal nations in preservation. So while a couple of them are facing performance challenges, it's all about trying to make sure that we do not lose any slots serving our tribal communities because those are the ones that would benefit the most from home visiting. And that's been actually very, very productive in these conversations that we've been having with those folks. And then finally, we recognize that in at least almost half of our performance issues are related to TANF funding and the inability of our DSHS local community service office partners in making referrals. And so it's something we've actually been working on for years, particularly since the pandemic. But we're ramping up some of our regional conversations around referrals and really looking at TANF home visiting and how slots are distributed and how slots are paid, because in some communities, those referrals just aren't happening and programs are being held accountable for things that they don't have control over. So that's kind of what's been going on the service end for us. I don't know if there's any questions about any of that. I think this is my only slide, or the last slide. One of the things I think we were gratified to see is how much strong performance there is out there. And certainly even in the conversations where there have been performance challenges, there's really deep dedication to services and serving families. And no performance issues that were identified were a surprise to anybody. So it was just an opportunity to have some good conversations.
Next slide, please. So just wanted to give a brief update on our system contracts. So we've shared a little bit about our LIA contracts. So most of our systems contracts will also see a reduction. And we had a couple of contracts that went up, and those were specifically our data system contracts, just because we had an increase in user fees. And we are continuing to negotiate some of those contracts. So we're hoping to give an update as to where things landed and how that impact any of the services our system contracts were providing. So we'll do that in July. So we're going to open it now up for questions from our HVAC members.
So I'm assuming that the 3 programs that closed down for the various reasons were their clients, their community referred to other programs, or is that now just this hole that happened as a result of them closing?
Well, I think, Allison, you're right. It is a whole. I mean, one of the things we're still doing with each of these 3 programs is exploring where families who were being served by those programs might exist. And the biggest program really is the Spokane area and the Akin program in Spokane. Akin is able to serve some of those families internally with other services and make referrals out to potentially the early Head Start programs, or and not really the NFP because they don't have aligned eligibility. So and in meeting with those folks, it was really like you were talking about how sad it was. They're very, very sad. It's like a lot of grief going on in Walla Walla. This is the only home visiting program in Walla Walla, and it's the Akin program in Walla Walla. So they again would be referring to the early Head Start and some other things, but those are pretty deep holes in the Bridget College program in serving the Mount Vernon Skagit community. They've moved the majority of the families into other Bridget College programming in that community, but there are probably about 6 families who were less engaged in the program and so are then therefore more difficult to engage in other referral programs. And so we did look at if there was a possibility of our sister programs up in either Whatcom County or North Snohomish County could serve them, but there wasn't really, the connections weren't really made. So that's definitely something we always follow up on. Not that we do this that often, but we did have one program say, hey, well, we'll take their slots. We were like, yeah, sorry, we're not expanding at this time. It would be lovely if we could have taken those slots and done that, but yeah, we didn't. So yeah, no, so these are gaps now in those communities. And I think the biggest gap is probably, well, it's hard to say what's the biggest gap, right? Walla Walla doesn't have home visiting at all. And Spokane is a very high need community and it's lost a lot of its slots. So we do have other programming though in Spokane. We have Nurse Family Partnership and we also have the Early Head Start Home Based has a few slots there.
Any other questions for MidTrack members? Any questions from our guests? Go ahead, Matthew. Thank you.
Hi, thank you all. Thank you for all this detailed information. It's really great to see. Seeing that there are details about the McV funded sites seeing at least partial increase to get closer to their rates amounts. Does that mean there's been approval from HRSA about the rates approach?
We're not moving forward with implementing those programs as rates, Matthew. What we did was we compared what their budgets are to what their budgets would be if we implemented rates. So no, HRSA has not given approval yet to implement rates, but we're using a rates-informed budgeting approach. So we looked at, like, for a program, if the rate is, we'll just say $10,000 a slot, but they were getting $5,500. We wanted to move them to $7,500 per slot if we could, to get to 75% of the rate. So no, we're not doing the rate yet. HRSA has not approved that, but we used a rates-informed budgeting approach to increase budgets.
Great, thank you very much.
Any other questions, thoughts about these first 2 topics?
Not so much a question, but just I guess a thought and a thank you. This could not have been in any way easy. And from an LIA perspective, it was a lot of torture in the waiting process, as I'm sure it was for all of you guys too. But when we did get our paperwork together, it was really clear how much thought and care went into that work. And I'm sure those decisions were incredibly challenging. And just thank you from our team, that we were really appreciative of all of the care that went into it in a really, really hard moment.
Thank you, Alicia. We are a lot ahead of schedule, which I don't often get to say with HVAC. I feel like we're constantly, oftentimes playing catch up. So we are way ahead of schedule. So I think it's also a good time just for us to take a break. We've also been sitting or standing or staring at a screen for an hour. So why don't we step away for a little bit and come back, and we'll do the last part of our agenda, which is kind of looking at FY26. All right, so why don't we take a break? It is 10:10. We'll come back at 10:20.
Nellie, the 3-minute stretch break. We're doing 10 minutes though.
Oh,
The
sorry.
slide says a 20-minute. That's okay.
Nope, let's come back at 10:30. Thank you, Laura.
Okay, 20 minutes. Just checking on that.
Yes, thank you. We want to welcome you back. So just let me know if you're back by either a thumbs up or an emoji, or if you want to turn on your camera, that works as well. All right, thank you, thank you. Could we pull up the slide deck? Thank you. So we're going to move into the last part of our agenda, and we are probably going to end early. And so it'll be an opportunity for a little bit of a gift of time, which I'm sure all of us could benefit from a little bit too. So next slide, please. So we're going to move into our subcommittee updates, and then kind of a little bit of planning around subcommittees in general. I know Gretchen had to step away for a little bit, but I believe Martha is on. So Martha, if you want to provide us with an update. Thank you. You're muted. There you go.
Okay, sorry about that. Good morning, everyone. Nice to see you all. I can a very brief update on the data and evaluation subcommittee. We unfortunately did not meet much this spring at all. That's mostly on my shoulders, just some bandwidth issues and kind of thinking about how we wanted to reset the table for the work of the committee. I think we're needing to this next year really focus in a little bit on membership and rethinking, reestablishing the co-chair setup now that Gretchen is part of the larger HVAC leadership. Thinking about a new subcommittee chair would be helpful to get that perspective kind of outside of the state agency perspective. So having a thought partner and a co-lead in this work's really important. And also thinking through what our membership for the subcommittee is really important as we chart our way forward. I think some of our other priorities, I imagine, for this next year would include continuing to focus on data availability, particularly for our LIAs, but also for other state partners. I know DOH is continuing to work on a transition to electronic dashboards, so interactive Power BI kinds of dashboards that sites would have access to. And that's something that's on their horizon for this next year that I think will give sites eyes on progress, that also the same kind of eyes on that the state has. And then I think the other area, so the data and evaluation subcommittee has a data focus, making data more available, more accessible, more useful for the sites and others. And then we also have an analysis and evaluation kind of component to our charge or purpose. And I think over this next year, we'll really want to focus in on some of the HVAC and HVSA priorities, thinking about a focus on enrollment, a focus on retention, thinking about what services are provided and the quality of services, and providing data and analysis to help sites continue to focus and improve service delivery. And that's all I have. So quick, short and sweet today, but I'm happy to take any questions.
Thanks, Martha. Next slide, please.
You ready for me, Nellie? Okay, thank you. Hello, everyone. Nice to see everyone today. Could you do the next slide, please? I think it's the workforce one. No,
Go back.
the one that I sent, it might not be in the deck, I wonder. It was, I can pull it up on my screen?
Yes, please.
Okay.
I think I may have missed
Okay.
adding it to it. Sorry, Nina.
No problem. Okay. Are you actually seeing it now? No, I've got to share. Hold on.
Yes,
Let me
not
figure
yet.
out where to. I've got to figure out where to share here. Okay. Yes, we are going to go here. And okay. Is it in? Are you seeing this slide?
We are.
Okay, and I'm just going to put it in current slide. Okay, hopefully that's showing now. Thank you so much. Okay, so I just wanted to check in really quickly to say that May 13th and 14th, we had our spring all HVSA meeting, and more than 200 home visiting and TRIO staff attended over the 2 days. And one of the I wanted to point out that as part again of this budget situation that we are in, both of the all HVSAs next year will be virtual. Will be virtual again. I did want to also foreshadow that one of the things we're going to be looking at in our workforce subcommittee is what trends we're seeing from May 2023 or May 2028, I think. But anyway, a 5-year, we have a 5-year purview or 5 all HVSA meeting purview of what's been going on with attrition and retention with the workforce. And the really good news this May is that we had the lowest percentage of people attending these trainings that were less than 1 year. That number for the first time was one of the lower numbers in all of longevity at both the supervisor and the home visitor levels. And so that's very good news. But again, that's one of the things the committee will be digging into first off to see where we're at. And also wanted to let you know that that we had done some announcements about the Washington State Substance Use Disorder Training Series for home visitors. That is a McVie-funded initiative that was part of the Senate Bill 6109 that was continued, and it will run through October 1 of this year. We have a specialized learning platform that that makes it really simple and straightforward for home visiting staff to sign up for. And because of the way the learning platform is set up and the whole series is set up, home visiting programs or LIAs, where home visiting programs are housed, are welcome to invite other participants from their organizations to participate. I'm still in the process of doing outreach to other home visiting programs to participate as well. And we're really thinking about this series and I want to invite you to think about if you know of family support organizations or folks that are working with families and providing services at community levels that could benefit from this training. It really is an entry level into understanding the sort of full picture of substance use disorder services, and also Washington State, the impact in Washington State in particular of fentanyl and opioids. So that is happening, and I will actually it's gone out, the invitation's gone out for registration, and it kicked off last week as well. And so I'm hoping that those of you who are LIAs are sharing this with your home visitors too. But anyone who attended the All HVSA received it. And then we had done in the spring a survey that went out to workforce subcommittee members to see if we could establish a separate time to meet. And we did not even have enough sufficient response to move forward. We anticipate that the first SFY 26 subcommittee meeting will happen. I said no sooner than August. I thought maybe that might be that July it may not happen, but there is a possibility it will. But at that time, we will be revisiting and repicking up some of the work we did, including making some advisement around the training survey that we had started to work on, and establishing new priorities for the coming year. This meeting has lost its cadence, and that was really some of that was due to the fact that the HVSA meetings we've had really kind of an unprecedented period of major changes and shifts in home visiting. First with the rates, then with the new budgeting happening, and so I'm hoping to see us find a time that we can establish and be meeting more regularly and working together. So that is all I have, I think. And I actually, now I'm going to stop sharing for a second. I'm going to drop in a chat. I don't think Monica made it back in. I think this was when she was out. But Monica, I believe a couple months ago that NUCHA presented on the People Powered Workforce Initiative. And there was a survey done, and there is a webinar coming up in June. And if you use that link that I dropped into the chat, it'll take you to the page where you can register. And this is about the infant and early childhood mental health workforce. But the exciting thing is that there was robust home visiting participation as well. So I think there's really some wonderful overlap with the work that we're doing, and I hope you'll attend. And so that's that one. And then I'm also going to pop into chat a document when I'm done talking. But we have been doing fan mindfulness sessions on Mondays in June, sort of acknowledging the stressors we've all been through. But that's been sent out to all the home visiting programs. But I just want anybody on this call is welcome to participate. And they're set up for half-hour long. They break at 25 minutes just to be mindful of people's needs for transition. So they've been really. I've done it for 2 weeks in a row, and they're just really wonderful. And they're hosted by this month is by Megan Jimenez, who is a fan trainer and mentor. So yeah, hope to see you there. And I think that's it. I think I'll stop for questions, and I'll look for the document I want to pop in there too. So,
Nina, Alicia had a question in the chat about the possibility of sharing the SUD training with the Family Support Center network.
Yeah, can you? Is that a statewide network, Alicia? I'm not sure. It's.
Sorry, I just took a bite of sandwich. Yes, it's a statewide network. It's run out of Akin, and Marilyn Gisser from your team is involved in it. But when you said that you were looking for other family support type agencies, that would be where many of us hang out.
Thank you. Yeah, and we are going to work with the CBCAP side of our Strengthening Family side too to invite folks. There's overlap with programs, but thank you for calling that out for me, because that's very helpful. Yes, we will invite those and those folks. And yeah, anybody else?
Any questions about the subcommittee updates? We have one more subcommittee thing related, but we want to get the questions out before we do that.
course, can I find the Monday morning mindfulness when I need it? Mindfulness to find the document. Anyway, okay, now I'm ready for the, I'm gonna follow your lead, but just, yeah.
If it doesn't seem like there are any other questions or thoughts. So we wanted to, because as I mentioned, when we started, we're at the last official meeting for our HVAC year for SFY 25. We wanted to do some resetting and updates to our subcommittee list, also giving people an opportunity. If you were in one subcommittee and are interested in transitioning, wanted to give people an opportunity to do that. So we have a quick survey, and this can also be filled out by any of our guests, because to be part of the subcommittees doesn't mean that you have to be a member of HVAC. So it's open to our guests as well. So we just wanted you to take a couple of minutes to make your way through this survey. I know that we are a small but mighty team today, so we're missing quite a few of our HVAC members. So this survey will also go out with a follow-up information after our meeting. So we collect this from as many of our HVAC members as possible. So I think Nina's going to put it into the chat. We could just take a couple of minutes and fill it out now, because it gives us an idea of kind of where we're headed and where we may need to recruit or focus on, depending.
Okay, let's see if that works.
Sure. So the Nina, you want to send it again? You send it just to me.
It didn't go in?
It
I
came
sent it to
me.
you.
Yeah. So if you want to send it to the main group. And while she's doing that, Marilyn, please feel free to unmute and ask your question.
Sorry, there we go. So the question I had, I was looking back at the principles that I think Renee or Laura shared this. So you know, support and stabilize LA operations, and then adjust LA contracts if possible based on availability of dollars. So because I know, it's hard for a lot of LIAs. When availability of dollars, is that related to, like, if there's 3 agencies who aren't going to be providing services, then those dollars are going to become available? Is it if there's other dollars that, become available in other ways? And I guess I feel pretty strongly about us, like, not sitting on that, because agencies are making really hard decisions right now about staffing. So I just wondered a little more if there's more information about that, or just to let that priority and that thought be known.
Yes, so Marilyn, the availability of funds is basically within the funding resources that exist within HEVSA. So those 3 programs that did not move forward, the funding has all been basically redistributed to LIAs. And it was really only except for the GFS, which was kind of incorporated in the reduction. The TANF funds will be pushed out, as well as the MCV dollars. So there's not other funds outside of what we have available, but the department is not keeping those funds as if like they're not being spent. They're just being reabsorbed back into the budget and back out to programs. At this point, we're not planning to do a short-term, like trying to get a program in Walla Walla this year, for example, to cover that reduction. We don't feel like there's capacity to do that within the funds that we have.
So like those have already been pushed out.
Yes.
Yeah. Because is that a way we could have underspend again?
If we did not do that, yes, it would be.
Okay.
But it wouldn't, again, really impact the GFS. It's more, and the underspend that the legislature was looking at, I believe, primarily was from general fund state. So that, again, has been the one program that had substantial general fund state dollars has been considered as part of the reduction overall as well.
I don't know, Marilyn, if your question is more to where you have purview on things like that. And I think in the past, we have come to HVAC when a program has closed and talked about what the options are. I think this time we didn't with those 3 programs. We just moved with absorbing them because of, in our perspective was we have so many programs that are operating on margins right now that it didn't feel, I mean, maybe we should have, but it felt like that would have just delayed the process for maybe redistributing dollars to programs that needed it, given where the budget was. So I think typically we would come to the HVAC and say, this is our recommendation on our approach. And we have run competitive internal, like we have preserved slots in communities in the past and run competition for those particular funds a couple of times after, walking it through with getting advice. But I don't know, like I said, I wasn't sure if I was hearing your question right, but.
Yeah, both your answers are helpful. I appreciate it. Yeah.
Sure. Any other questions that people have thought of as we're making our way through before we move on? So Nina drops the survey into the chat. If you could take some time to fill it out while we're here together, that would be great. And as I mentioned, to also go out at after the materials for our follow-up to this meeting. Marlene, could you pull the slide deck back up?
Is this the where you're at or?
Yes.
Okay,
So,
great.
yeah, if you can just hit the next slide, that'd be great. Next slide. So, sorry, that should say SFY 26. Here are our proposed dates for our meeting schedule for next year. So our July meeting is really to do kind of a wrap up to the year and to really think about what we want to do in SFY 26. I think I have a slide coming up, but just wanted to take a moment. If you could take a look at this, and if there are any kind of obvious or things that jump out at you that would make attendance difficult. So do we have a conference that's happening then or something along those lines for these particular dates? So I'm just gonna give a minute for people to take a look at them and to kind of consider if there's something that we may need to kind of adjust these dates for. Also send them out with follow-up documentation just to see, again, because I know we are a small team today, so want to make sure that our other HVAC members have a chance to weigh in. Next slide, please. So I'd sent this out also with the agenda, but just wanted to highlight it here as well. And I also just want to take a moment to just again recognize that we now have a co-chair structure with Gretchen and Marilyn. So we had our first HVAC planning meeting, it was a week ago. I was kind of thinking about this July meeting agenda and where we wanted to support HVAC and starting for SFY 26. So here are some of the things that we'll talk about at our July meeting. We had started some of these conversations, I believe this year and a little bit last year, So we'll get to a place where we can make some decisions about how we move forward. And then we'll also have kind of a budget and contracts update as part of our meeting in July. Are there any questions about this meeting or anything else that we should be looking at or considering?
Nellie, I just wanted to add that that survey will give you a chance to weigh in on information about who to include at the table that goes broader than just the subcommittees as well. You'll be able to give your interest in subcommittees, but also kind of help us with some of what you're talking about in that membership and recruitment. Yeah.
Thank you for pointing that out, Lena. Next slide, please, Marlene. So again, this is just our question section. Are there any questions about the updates or any questions in general about what we've talked about today that came to you as we were making our time through and you didn't get a chance to ask? And this is open both to HVAC members and our guests. So I just want to take an opportunity to say thank you so much. Like this has been a year where there's been a lot of engagement, a lot of conversation. We've talked about a lot of difficult things, and you have stayed engaged. You have offered a different perspective. You have challenged us. So it has been, I felt like, an amazing HVAC year. And I know it's because of each and every one of you who show up every week and engage and participate and ask questions and do all of those things. So I just wanted to take a moment to say thank you. And I know it's also come at a time where there's been a lot going on and people are being pulled in a variety of different directions within your agencies as a result of constant changes that are happening. So it is a sacrifice to be here in this space. And we just want to say thank you for that. And thank you for engaging and thank you for participating. And we're looking forward to an even more amazing opportunity for collaboration as we look at and think about state fiscal year 26. So I'm hoping that we will see a lot of you here in July. Again, I'll send these dates out so that other HVAC members have a chance to weigh in and we can see if that is a date that works for most or if we need to make some shifts and changes there. But we'll have one more kind of official beginning to fiscal year 26. So with that, I just want to offer another opportunity for any questions or any thoughts before we wrap up. Well, again, thank you all so much. It's great to be able to give back a little bit of time, because I know several of us could use that, and time that you're supposed to be in another meeting, so nobody's probably expecting you to do anything else. So you have the gift to spend it however you choose to spend it. And again, when I say thank you and looking forward to connecting with you here soon. Bye-bye.